So welcome to the webinar hosted by the Illinois Public Health Institute and the Aging and Disability Business Institute. We're going to start with introductions from folks on our team, though the primary purpose of this webinar is for the members of this learning collaboration to get to know each other. Here in Chicago, Illinois, and in Springfield, Illinois, we have the IPHI team. I'm the director of the Center for Health Information and Technology, and I work on this project and a couple of other national projects for IPHI.
Hi, this is Anna Barnes. I'm a program manager.
This is Antonio Lagos. I'm a program associate.
Hi, this is Laurie Call. I'm the director for the Center for Community Capacity Development.
Great, thanks. And we've got our colleagues from n4a on the call. Would you like to introduce yourselves, please?
Hi, Peter. Can you hear me? This is Maya.
Yeah, Maya, we can.
Oh, sorry. There's an issue with the muting on and off. Yeah, this is Maya from n4a Business Institute, and I'll be working with Mary and Marissa on this project with IPHI.
Great, great. A lot of you in the membership of the cohort have heard from Mary and Maya, and they'll be along with us for the full ride. Next slide, please. So we're going to try not to repeat elements that we've already experienced with all of you. For all 10 members of the cohort, we've already had really great introductory conversations, but just to sort of state publicly what we've said to each of you individually, the vision for the learning collaboration is really about peer-to-peer learning that's going to advance the work that you're trying to do locally. And so we're also at the same time, by tracking what we're doing with you, we are contributing to the body of knowledge for n4a and then wider into the field. And so it's really kind of a 2-for-1 bonus. Next slide. We also thought it might be valuable to throw up on the screen, and I'm not going to read this, but when you applied for the learning collaboration, you saw this information about the purpose and a key outcome. And so we're really excited about this opportunity because you all are high capacity organizations that have some really specific ideas about what you want to do over the course of the learning collaboration. And so it's our job at IPHI to support that work, to document what you're doing, and to make connections between you. There is a component also of external technical support where necessary. So I think all of you got a copy of the agenda, but just to run through it real quickly, because we have 10 members of the cohort, we're going to break up the introduction. So we'll do a set of 5 with a little bit of reflection time from Lori. Anna will talk about the structure of the learning collaboration itself, and then we'll have the second group of 5 introduce yourselves. Then Lori will spend some more time kind of synthesizing what we're hearing from you, and then we'll talk about kind of the platform that we'll be using for this, and then talk about next steps. So all of you know that you're a part of this health IT collaboration, but where are you today? Well, this is where you are. Apparently, we're clustered on the the northwest. We have friends in Arizona. We got a few folks that are in the Midwest there, and then a little bit on the East Coast. So we're not nationwide because it would be tough to do that with 10 places, but I feel really good about the spread that we have with lots of lessons that we can apply across the way. We've got a couple more slides about sort of what constitutes the cohort. You're pretty close to half and half. Those of you who said you wanted to work on care coordination and kind of whole person care. And then the other half of you said you're interested in evidence-based health promotion. And so, that's a 60-40 split. half of you are pretty big organizations. Why we're doing the break at 79.5 instead of 80? But half of you are pretty big organizations, and then the rest of you are under 80 FTEs. Most of you are independent nonprofits. In terms of your technical maturity, I think this is really interesting, and this is really kind of a reflection of what we are hoping to do with the collaboration. 4 of you are earlier in the process, and then 1 of you is in really active use of a technical system, and then the rest of you are kind of in the middle. And so this is by design, both because of sort of where the high capacity applications were, but also, we thought over the course of the year, having folks at different levels of project maturity would really facilitate a lot of really interesting conversations. So we're really pleased with that spread right there. We also asked you if you're hiring an IT vendor. Half of you said yes, you were. 2 of you said we're not going to do that because we have internal capacity. And then 3 of you were not yet ready to make that decision. So I know this is a quick jump in, but we really want to reserve the bulk of the time today for the site introduction. And so this is where I want to tell you how we'd like this to go. We really want to model the fact that we think the wisdom is in the room, as I'm pretty sure I said to everybody when we had our introductory calls. And so that means that I'd like you to sort of think about the following 4 questions as people are making their presentations. As they're making their presentations, please be thinking about whether they're doing something that's similar to what you're doing or they're at a similar stage of the work. Are their barriers seem to match up with the kind of barriers that you're facing? Do they have a solution or approach that you think might be helpful to you? Or, it's an and do you have something going on that you think would be helpful to somebody else? And so the ideal for this process is that you all are in the chat box and chatting about this throughout the webinar. This is one of the ones where we say we do want you to text, but we want the texting to be to each other. We will have a real quick, we'll reserve maybe 30 seconds at the end of each presentation to ask a question, and then we'll move on to the next. And so I think you all have the order, and we're going to be starting with the Maryland Living Well Center of Excellence from Salisbury, Maryland. And so Antonia, if you can. All right, so we're gonna unmute everybody, and so the folks from Maryland, if you could identify yourself, then we'll make sure that you stay unmuted. If you are not speaking, please mute yourself. We've got 36 people on the call, so we can't manage all of the background noise. So please mute yourself unless you're speaking. Go ahead, and I will be keeping time.
Hi, my name is Leanne Eagle. I am the who is the executive director of Okay. I have Patty Tingle, who is the I have Lackameyer is the coordinator. Brandon Tyre is the IT. I'm a coordinator here at MAC. I'm a specialist. We have Larry up is the a planner. Our problem statement: identify a health I'm a system track delivery impact. Also notifying referring entities of the program outcome, cost saving, and my healthcare utilization. Basically have separate needs, one for MAC and the IP of excellence. And that's another separate need because we work with 26 different kinds of healthcare partners that we need to be able to have our IT needs met with. So that's the Maryland Living Well Center of Excellence, MAC Inc. And here are the barriers. We're unable to identify the mechanisms to link the data to the hospitals. That bidirectional education or the bidirectional sharing has been difficult. We lack the expertise around the available IT systems, as well as we lack the clarity on what we need to do. We need the other top 3 project goals is to provide a sustainable access to the evidence-based programs, to identify the potential IT systems that we need to use, and we need to be able to implement the systems. So we need them all to talk to each other so we're not doing double entry. Next slide. So that is basically what we're trying to do as part of this hub and a collaboration. Sue, do you have anything else you would like to add? Patty? Brandon? Okay, thank you.
Wow, you made it in 4 minutes even with that break. Thanks very much. Next up is Lutheran Services in America. And so let's unmute Alicia, Swati, Tim, Chen.
Hello, this is Alicia. Can you hear me okay?
Yeah, we can, Alicia. Go ahead, please.
Wonderful. And then I guess the version of the WebEx I'm looking at doesn't have our slides, but I'll be glad to start speaking to them. I don't know if there's a slight delay on my part.
I think there is. They're up now.
Okay, wonderful. Thank you. Appreciate that. So we are Lutheran Services in America, and you can page ahead here, and I know I've got my 4 minutes. We're a national network of over 300 health and human service providers, and we provide a variety of services, including senior services, behavioral health, intellectual and developmental disabilities, children, youth, and families, with a strong focus on care management and care supports. And so what we have assembled a team, and we're really excited to be part of this collaborative, so really appreciate the opportunity. We'll be sharing the learnings more broadly with the network, but we have some dedicated team members who will be working closely with us throughout this year. So myself, Alicia, and Swati, who's on my team, as well as Tim Sheehan, who's Vice President of Lutheran Social Services of Illinois. And I don't know if, Tim, if you're unmuted and you can say hi. And we've also I'm not sure exactly where we reported ourselves on the continuum, but we're actively working with Nate Tyler and Shannon McKinsey, who are helping us with our technology platform in terms of Simply Connect. We're actually using this platform in both the senior services as well as in the IDD and behavioral health space. But for today, we're really going to be focusing on some of the work that we're doing in the behavioral health. So really looking at a person-centered care management approach, and talking about ways that we can increase access to care and share data across the provider community, and really help change and transform the results and outcomes and lives of the people that we work with. So if we could page ahead. We have some, lots of barriers. We limited ourselves to the 3, but we really look forward to talking with folks and hearing how they're planning, how they're thinking of things. I think one of the things is really understanding how we can streamline implementation and share platform and tools, so that we're not always reinventing the wheel, and that we can build, I like the way you said it, Peter, add to the work doing locally and build sort of on the success and experience in the past. Really want to have a conversation also with this group about how they've used data to improve and refine their practices, and how are they seeing that this technology really enables a culture of outcomes and accountability, and are there ways that they're seeing that manifest itself? And then finally, how is this helping with sustainability and conversations with Medicaid managed care, and are, organizations, how are they using this, their platform and their data to better position their organizations with, sort of this new payer stream. So those are sort of the three barriers and challenges that we look forward to talking to you all with. In terms of our goals, I think they map closely with our barriers, but really how can we streamline these? How can we align the payments and incentives for positive outcomes? And then really how can we, work in partnership with, the Aging and Disability Institute and other partners to really help develop that business acumen across the network, so that we can help, be active, have an active role in setting prices, negotiating contracts, managing to those accountability outcomes, and really improving, lives and outcomes across the country. So let's see, I think, did I get in under my 4 minutes?
Yes, if you want to tell jokes for 20 seconds.
Okay, so what it gives me is maybe a second to just ask Tim and Nate if I left off anything important. And I might assume, or Shannon. And I'm sure that they'll join in if I did later as the conversation continues. So thanks again for having us.
Thanks a lot. A reminder, folks, keep the chat going. It's great. We're not going to answer all or even most of the questions today, but they are going to go into our design for the learning collaboration. Okay, next up is Western New York Integrated Care Collaborative. I guess I should say we're going east to west in case anybody was wondering how it was organized.
Hi, this is Nikki Kaminsky from Western New York Integrated Care Collaborative. Thanks for having us. I'm really excited to be here. I believe on the phone, or on the webinar anyway, is also one of our board members, Mary Kay Comfort. So our problem statement, basically, we are really close, we think, to contracting with a health IT portal. We have a network of community-based organizations and AAAs. Western New York Integrated Care Collaborative is basically the hub of those network member organizations, with the goal of bringing regional standardization, but also sustainability and reimbursement to those community-based programs. And so our goal is to have an integrated health IT portal that all the regional network members can utilize, that's efficient, easy to use, able to integrate with provider health records and the member organization's existing, which I spelled wrong, just saw that, platforms, to avoid duplicate entry, and to be able to use that platform to bill from. So it has to have all the billing requirements that are required. Okay, so some of the challenges are just contract negotiations and integrating. I already kind of mentioned that integrating. We want to really have one platform that, again, avoids that duplicate entry and will be easy to use and work for all the services and programs that we want it to work for. And we also, I think similar to what they were saying from Lutheran Services, is we want to learn best practices for how to use this data and outcome information that we're collecting, use it to the best way to promote the programs, to show providers and insurers, what great work we're all doing. Yeah, you can keep going. How close am I? Oh,
2
you
minutes.
guys all hear me? Oh,
Yeah, we
oh, I have
can. 2
2
minutes,
Okay.
please.
All right. Keep going on the slides, and I'll see what else I have to tell you about. Here's a little diagram of this. This works for both our IT portal, but also the whole network that we've formed. Is that our organization is basically that central hub, and our network partners are kind of down there on the bottom of the diagram, doing all the community-based work with the patients and participants that they always do. And now they have a way to link with the funders and the providers. And we really want that health IT hub to link it all together. Okay. One of the lessons that we've learned is that the health IT portal that we were trying to work with was kind of slow in negotiating with us. So we formed a little committee with Oregon Health Network and Greater Community Council of Greater Dallas to work out these negotiations. And it turned out to be a great resource for collaborating on other things, asking questions of similar organizations and networks that are trying to work towards similar goals. So that's been a really cool lesson that we learned. Things we'd like to learn from you guys are what health IT platforms do you use? What do you like about them? What do you not like about them? And how do you use the data you collected? And what kind of like information graphics, or what do you find the best way to present the data to really show your outcomes in the best way?
That's perfect. Thanks so much. And
Okay.
it is
You're
fun.
welcome.
You've got a little mini collaboration of your own right there with your two partners. So that's something that we can learn from. Let's go on to Michigan State University Extension.
Yes, hello. I'm Dawn Opal from Michigan State University, and I'm just waiting for my first slide to come up. Here we are. So I am leading this project as an assistant professor and a researcher, and I study community care coordination, and I'm working with the Michigan State University Extension Service, which provides community-based, evidence-based programs related to health and nutrition all over the state of Michigan, and partners on grants with organizations like our HITLCs. And our problem statement is that we're really looking to figure out a way that we can tie our community-based programming to healthcare outcomes and be able to share data across all of our partners on our various grants. So if you could switch the slides. Yep. So I think this resonated with me with someone that just said they don't know what they don't know. Lack of knowledge about what tools and platforms exist, or an understanding of how we could possibly get everyone to be on the same one. That's something that we're really interested in learning more about, and we're hopeful that we can identify both IT and data management so that we might be able to start collecting health care related outcomes for the programs that we offer across the state. So we currently have support from lots of, and are collaborating with lots of other community-based organizations, and recently have started working with healthcare networks, hospitals, and providers. And so ideally, we're in the stage where everyone is interested and enthusiastic and on board, but we do not yet have, we do not yet share data. We'd all like to be able to, but we haven't quite figured out how to be able to do this yet with the networks, the payers, and the providers in the areas in which we serve, as well as all of our other community-based partners. So what we'd like to be able to do is that the Extension Service is quite large and has educators throughout the state teaching various health and nutrition programming to Michiganders, and we'd really like to be able to have data sharing wherein we could search and retrieve data related to program participants, and be able to make both intra-office referrals inside the extension service, so from one program to another. We'd also like to be able to have an IT solution that allows us to know which healthcare providers are referring to us and also track those health outcomes. And so we'd also like to figure out how to make getting all on one platform attractive to healthcare partners.
Hello, I think I'm unmuted now, right?
You are, yes, please go ahead.
Okay, I'm Jenny Hamilton. So Livestream Services is a 501c3 independent nonprofit area agency on aging, and we currently serve about 10% of the state of Indiana. If you know Indiana, we're east and northeast of Indianapolis. So, and there's our team members, myself, Megan, who works with me and oversees our case management programs, Paul, who is our wonderful, great IT guru who understands terms we don't. And then Vanessa, we just added, she is with our State Division of Aging to help us with some of our data. Our problem statement, it's all about care coordination, case management. We know we do a good job. How can we get the information and the data to show that? And here in a minute, I'm going to talk about why that's a challenge, but that's our goal. So we currently have a state software that is almost 20 years old next spring. So that's not easy to work with. And trying to get historical comparisons, it's geared toward the current information. So we're trying to figure out how to get historical information and then also to benchmark it against some other data to really show our impact. Our goals, we would like to get some outcomes data. We're working on NCQA accreditation right now. We would like outcomes data on social determinants of health to talk to healthcare systems about and use. And then more of a plan on how to use the data with healthcare systems. So we're hoping out of this, you know, we've been involved in some of the business acumen discussions and things about how to take it further. That slide I obviously did not get completely filled out. So imagine there's more X's there, and we'll come back to that. We really want to get data to share with those groups. So I don't know what I was thinking. Envisioning success, I've got my little missing puzzle piece there because we'd like to have data to show the impact we have on those we serve. We would like healthcare systems to realize that we're a missing piece to help with some of the social determinant of health issues that right now I think they're out there making their own systems instead of realizing what we could offer. And we would like to be looked at as a partner for healthcare and be a true partner in population health for those that we serve. And was that, oh, I got one more. So part of our difficulty is trying to recreate historical information after the fact because, again, of our current system. And we're required to use it, so that can be kind of a barrier is if we're required to use it, what can we still get to go along with that? So if anybody else has any experience taking some of the data that's captured maybe in an older format and making it more useful, that would be great. And then one of the other questions I had was what pieces of information that people pulled out to help people get in the door. Because if we're trying to piecemeal out or get information out of our system, kind of what to look for, what has worked for other people.
That's terrific. And you win the prize for leaving the most time for others. So thank you. Let's
You're
take
welcome.
advantage of that and go back to Leanne for a well-deserved look at Maryland. And I'm going to quickly go back to the slides, so please bear with me as I go back. Leanne, are you with us again?
I'm right here.
Please go ahead.
I guess I'm waiting for you to get to the slide where we, why don't we go to the barriers. I think we've already done the barriers. Next slide. The partnerships and data sharing. We already with the Center of Excellence have 26 healthcare partners across the state of Maryland. That's because we're already on a single payer model for the state as far as the hospitals are concerned. So we have very good partnerships. So where we lack is how we can share the data. Some we are sharing the data with through an HIE, through our healthcare and information exchange, which is crisp in Maryland, which we currently have a MOU with. And we are getting those profiles in, receiving those back. That shows us whether those hospitals or whether those people going through the programs have been in the hospital or the ER. So that gives us very valuable information back on our ROI. Next slide. And here's how we envision our successes is we want to have a seamless linking to multiple data systems and points of data. So the flow is going flow so we can also bill and we can get my reimbursement for our services. We want to be able to track multiple programs and services linked to healthcare utilization, similar to what we're doing with our HIE. We want to provide IT services across the aging network for the EB programs and other services. We want to be able to, as we screen people into the social determinants of health and social isolation, we want to be able to feed that referral back to our MAF staff and get that information back when those social determinants issues have been solved so that we can get them in EB programs and then let the healthcare partners know these social determinants of health and the have been resolved and they're now in a program and what that plan is. Next slide. Here is the first step of our referral and enrollment process. We did this with our local hospital. Just let you take a look at that. That is currently our, what we call our pathway. As you know, my referrals can come in by a self referral, a community outreach, or from the doctors or the themselves. So we just track that through so you can see how that pathway goes. Next slide. And we are also integrating the evidence-based programs and home and community-based programs. We have a hospital to home. That's where the hospital or the MAC has a CHW that goes out and visits the patient in the home, which that's gone very well. We've been doing a lot with shelf-stable meals. So that way, when they get released from the hospital, we can deploy the shelf-stable meals. We also need a way to track that. Is that keeping someone out of the ER? Is it keeping someone out of the hospital? So we want a means to be able to track all that. Next slide. Learning and sharing. We just talked about the health information exchange that we would be more than happy to share. Expanded opportunities where we have 26 healthcare contracts. So I think that's something that we could probably help with. The hoping to learn from others is what key data pieces we need to be collected so that we can start to bill, to show our ROI. We want to be able to, the examples of the IT, we need to know which ones are flexible because we know some of our hospital partners want raw data. So we are outgrowing our EB data system, so we need to see what is out there. So we only have one system versus multiple systems.
Great. Thanks very much, Leanne. I want to go down to Lori. If you're in a place, or not Lori, please stand. If you're in a place where you can stand up and stretch, you should do it because 90 minutes is a long time for a webinar. And while you're doing that, Lori, please go ahead and give us your first reflection.
Oh, sure. I mean, I think that it's great. We're hearing people ask each other questions, and so there were questions that came into Maryland about their linkage to Medicare and Medicaid payment, and they were able to answer that currently the payments that they receive for Medicaid funds or services are waiver or case management fee-based. There was a question for Lutheran. Do you have any providers in Washington or Oregon area? And I think they responded that they check into that. There was also a theme about just talking about the culture of outcomes and accountability, that's something that everybody's, you know, looking to be held or is accountable for, and trying to think about the ways that the data can really help them show those outcomes and accountability and that return on investment. So I saw that. There were a few questions for Western New York about their structure and their governing body, and they were able to respond that they are a nonprofit 501c3 and a network of CBOs and AAAs. They don't have a health plan as part of Western New York ICC right now, but they're meeting to discuss billing and guidelines. The visuals, people are really liking the visuals that people are sharing. That seems to be speaking to folks. And there was a question for Michigan about what CBOs you work with, and I did not see an answer to that. So MSU Extension, you might want to respond to that, what CBOs you're working with. And then just a couple questions that just now came in, or one question that just came in for live stream about planning to bill for any of the, if you're planning to bill for any of the services. So that's definitely a theme that we're hearing. And then a comment that just came in about Maryland slides, that's really just the tip of the iceberg in terms of the complexity of the processes and services. I think we're starting to see that across all of the slides, the major complexities. And that was it. That was it in terms of the comments. So thank you.
Great. Thanks, Lori. This is Anna Barnes. So we're just going to pause for a minute here, and if you think of other questions, feel free to keep chatting those in. Next slide. So we want to talk a little bit here about the structure of the Learning Collaborative and the activities that we planned. Just for a quick overview. That's right. So let's pull that up. So for key activities, we have planned 6 full cohort webinars. And I'll be showing this in a visual timeline graphic as well. But the full cohort will be this team that's on this group representation of everyone from the sites like we have now. We'll be doing 10 work group webinars. So we'll do 5 for work group 1 and 5 for work group 2. And we'll be talking a bit more about those at the end. We will also have 3 opportunities for one-on-one check-in calls like we just completed this past month. And then we'll also be, in between the webinars, we'll be having homework assignments, and those will be opportunities for you to work on an independent project or piece of work that advances your project locally, and a way to share with each other and get reaction and support from your peers. We will also, throughout the Learning Collaborative, be offering opportunities for group coaching, either with a subject matter expert that's identified or with a small group of peers. We'll have 2 evaluations that we'll ask you to complete at a midpoint and at the end point, and we really take that feedback seriously in terms of process improvements that we can make to strengthen the Learning Collaborative as we're going along. And then lastly, we have our all-in online community that Antonia will be speaking about briefly later this webinar. So next slide, please. This is just a visual representation of the key activities and touch points that we'll be having with you. So we just wanted to make sure you had an opportunity to kind of think about the structure here that we'll be unveiling as we move forward. So that's it from me. We're going to pass it back to Peter, and we're going to have the other 5 sites share their slides.
Thanks, Anna. Everybody, if you're standing, you should sit down again because we want you to keep chatting into the box. Antonia has added the full slide deck from today's webinars, and you can download that from the dashboard to the right. I like to stay really near Chicago right now and go out to Oak Park for age options, continuing our trip from the East Coast to the West.
There we go. Hi, this is Megan from Age Options. Can you hear me?
We can. Thank you, Megan.
Okay, wonderful. All right, so at Age Options, we have Rob Mapes, our Director of Community Programs, Joan Fox, our Health Education Program Specialist, Nikki Briggs, our Health Education Integration Coordinator, and then also Peg Tully, our Health Education Implementation Coordinator. So our goal is to find a user-friendly, HIPAA-secure database collection tool that's easy to use and for our partners to also have accessibility in. Currently, our system, we're using 3 different types of systems. So we have a website that partners go in to schedule, and then we take that information, we enter it into another system, and then after a workshop, we're re-entering information again. So it's a lot of double work that's taking place, using up a lot of staff time, not only to schedule a workshop, but also then once a workshop's complete and entering all the data and pulling the data. Our partners don't have access to their information, so evaluations tools, once they're done with a workshop for CDSMP and DSMP. So after we enter everything, then I pull reports within our system to provide them the information that they need, whether it's one workshop that they just had or on a quarterly, semi-annually, or annual basis for them to look at. And once again, the redundancy of entries and the lost staff time that is put into all of this. Our goal is to find a universal system that allows multiple users, so having it controlled where partners can put in their evaluations, where we can have a one-stop, they register a workshop, and there's not a dual entry on our part, but more of like a maintaining and checking in on it. One platform for scheduling, data entry, reports, et cetera, and making sure it's HIPAA compliance as well. Currently, we have a lot of partnerships and relationships, I guess I should say, and also at a programmatic level, and then sharing data. The problem with our current systems is with each different healthcare provider that we work with or different organizations, they all have different ways that they provide their information to us when they're giving us like a sample amount that we call in for new workshops. And so it's costly for our system to make those changes each and every single time so we can upload it into our system versus having one of the team members manually enter it. So currently we're looking at developing more contracts with healthcare providers, but finding an easier way to share that information and have it sent across that's secure. Our success would be a data system that would allow all partners access to their program's information, reduce staff time for entry, processing reports, and a one-stop statewide resource. So currently we work with the entire state of Illinois with AAAs, healthcare providers, county health departments, housing programs, you name it, hospital systems. So finding something that meets the requirements, whether for HIPAA and PHI, so that it can meet the needs of all providers instead of having to make adjustments to our system and having that redundancy. Lessons learned, that it's okay to work with one system and then look at others. And just because you start with one system and figure out kind of the quirks of it and you get it to work doesn't mean you have to keep it forever. That HIPAA secure is vital for all data systems and really making sure that you're able to track the logins of everyone who's going to go into the system and be able to control who's entering data, who's taking data, so you can have a log for that information as well in case things go missing. So we hope to learn other systems other partners have looked into and are used and how they currently manage their data systems and the evaluation information that comes in.
Terrific. Thanks so much. Let's now go way west and way south down to Tucson, Arizona with the Pima Council on Aging. We are unmuting you now.
Hello, everybody. Can you hear us?
Yes.
Great. So while our slides come up, we've got 5 folks on our team. 3 of us are here today. Rebecca and Victor, I'm Victor, and Tony are here today. For the most part, you'll all see Rebecca and me primarily, with the other 3 as silent partners on the webinars, but active partners within the agency. We're the AAA for Pima County, Arizona, which is the 2nd most populous county in the state. Pretty big area. And what we're really looking to do is what a lot of you all are looking to do is transform our data systems. We need to be able to really manage the day-to-day business of the agency while being prepared for the future, and that's really what we're looking at. Our barriers, again, very similar, is that we've got data all over the place, and that has made it challenging for us to really be effective in catching trends, in some preparation for the future, and those kinds of things, especially to really get the impact of our service on the people we serve. We have a lot of anecdotal information, but not really analytical data that we can say, here's what we're really providing, and here's the impact, and here's the return on investment for what our funders are providing money for. So for our project goals really is to get us to the place where we understand the data that we need, to understand how we need to leave ourselves open for the future, and select a system that's flexible to allow us to do all that. That's our goals for the time of the collaborative. And as you can see, we really do a pretty good job at relationships and partnerships throughout our community. We see a lot of X's there, but really they're all partial X's. We share some data, we may share it one way or not the other, but we have very strong relationships that we think will position us well to expand what we can do and how we share data and who we share it with. Next slide. Envisioning success. Really, it's about internally having something like dashboards, something that gives everybody the data they need to manage the work they need, while allowing us to be ready for anything that comes in the future, where we may be able to work with more healthcare agencies and what we provide, to be able to partner with new or existing agencies to provide services that we don't already provide, to better serve our aging community. Pima County is aging way faster than the national average, and our nice, warm, sunny weather brings a lot of people here, and they stay here. So Pima County has a lot of aging people. Next slide. Learning. So what we've come to realize is that we have focused on what we need, on the information we need to report to our funders. And that's basically how we run our hodgepodge of databases and Excel spreadsheets and notebooks with tick marks on them, is what do we need to report to our funders? And while that's extremely important, that's not really how we want to run our business. So really we're looking to work with others on how we go about reworking some of our workflows, to be smarter about the data we collect and why we collect it, and strategizing that collection to be able to be strategic about the decisions that we make.
Terrific. Thank you. Let's keep moving. We're going to go now to Seattle, Washington, and sound generation.
Hey, this is, yep, there we go. Hi, this is Paige Dennison. Can you hear me okay?
Yeah, we hear you fine, Paige. Thank you.
Okay, super. Okay, I think our slides are coming up right now. So we're Sound Generations. We are a multi-service 501c3 located in Seattle, Washington, the King County area. And we, everything from Meals on Wheels to transportation, caregiver support, as well as the evidence-based programming that we do. We are a little unique in that we actually are the administrator of 2 national evidence-based programs, as well as delivering 8 regionally. So those would be the Project Enhance programs. The University of Washington Health Promotion Research Center are our scientific advisory partners in that work. So on our team, we have myself, and I am fortunate to oversee the department. Camille Gabriel, who is on the phone as well remotely today, and Camille brings a process improvement lens to our work. John Gleichman, who is the director developer of all the information technology within our organization as a whole, and Megan Thompson, who's the data manager for the Project Enhance programs, as well as overseeing the data management systems for not only the Enhanced programs, but PEARLS and Matter of Balance as well, and the National Falls database in a contract with NCOA. Ann Turner is not joining us today because it's the AMIA, the American Medical Informatics, I hope I have that right, meeting is going on today in San Francisco. But we're fortunate to have her on our team. She's also a physician, so she brings that perspective as well as the information science perspective and population health because she teaches informatics to graduate students at UW. So we're very fortunate to have her be part of our team as well. And our problem statement really is all around sharing data with healthcare is where we're looking at today and how to do that better. The 3 barriers or challenges to date: lack of knowledge on the healthcare side of the equation, wants and needs. Sometimes we think we know what that may be, but truly physicians may not want that data, or payers may want different data. So there's a lot out there. The burden of data entry in multiple systems, and I think we've heard that theme today, is certainly a challenge and a barrier, and of course cost. And then our top 3 project goals and our outcomes are: we want to pilot in this 1-year work together, we want to pilot a referral and program outcome feedback loop with an identified healthcare partner regionally, and adopt best practices around data security and demonstrating HIPAA compliance. It can be a little bit of a moving target with all the documents that we receive and requests receive around data sharing and BAA agreements with national organizations that we support. So we'd like to get some standardization there. So we have a lot of what I think Victor used the term partial X's in boxes. And so while we have a lot of marks in boxes on this page, part of this is because we provide data systems that members of these categories use to manage their evidence-based program data. So we actually have affiliate relationships with about half the wonderful folks that are on the phone here today that are doing transformative work in their communities. And then we have relationships where it's a regional relationship, like our relationship with Kaiser throughout the state of Washington. So lots of little asterisks and partial X's in these boxes.
We're at 4 minutes. Can you just take 30 seconds and tell us the most important thing for the rest of your slides?
Sure. Let's go on to the next slide. Would be great. Really, what we want to do is have an efficient, nimble, and secure information sharing system. It's going to help with proving ROI and increased being able to get programs adopted. But also, we want to look beyond the evidence-based programs into other solutions within our organization.
Terrific. Thanks so much. Let's now stay in Washington, but go to Vancouver.
Hi, this is Vancouver. Can you hear us?
Yes, we can.
Great. So here today we have myself, Whitney Oswald. I'm the Quality Assurance and Trainings Coordinator. And we also have Tom Waltz, who's the Contracts and Development Manager, and Julian Fan, who is our IT Coordinator. But essentially, we joined the, we've been calling it the HIT Collaborative, because HITLC does not really roll off the tongue. But we're really trying to identify the best ways that we can evaluate our programs, our data use, and our access so that we can leverage these to form partnerships with other key players in the health of seniors and adults with disabilities. Next slide. So as you all have probably experienced, there's a lot of barriers with this. Like I think someone else mentioned earlier that they have a hodgepodge of platforms. We have the same. Every funder that we work with has a different platform that we have to put data into. So trying to pull reports or data from the different platforms is difficult, as well as understanding what are the common data points across the programs, because they're all asking for different information and they have different assessments, so it's difficult to understand what are the commonalities between these that we could use to understand our whole population, and which data points are most useful and relevant to our goals, and then understanding how we can get that information from the systems. A lot of them, the systems we use don't have reporting capability, so should we purchase something to use to get that data out? Should we work with the partners of those platforms to get the data? Just deciding how we can best do that. And then finally, synthesizing and analyzing the data in a way that we can use to leverage our voice in the community and build those partnerships with different entities. Next slide. So like a lot of AAAs or community-based organizations, we have a lot of partnerships and relationships with different entities in the community. Most notably right now, we are becoming a home health lead in our areas, which means the managed care organizations that we partner with for our care coordination services, we are going to be a lead and distributing those referrals for those services. So that might lead to better access to some of the platforms or control in some ways. So we're interested to see how that plays out. We also work with hospitals, VA, different entities at different levels, but we'd always like to share more. It's difficult to share data across those partnerships, especially when there's not necessarily business relationships with some of them. And of course, we have different platforms that don't talk, and HIPAA compliance is also another aspect that we have to be cognizant of. Next slide. So for us, we've been working on data for quite some time now. And for us, we really want to be able to seamlessly share data with healthcare groups and also our state partnerships. We're generating a lot of data and sharing that in as much as we have our partnerships and we have to for reporting on the services that we're providing. But we really would like to be able to access data that we feel is relevant to us instead of just what we have to report for our funders. And we also have a partnership with Washington State University to kind of do some objective and independent analysis of some of the data. And we're hoping that we'll be able to solve the issue of extracting the data so that we can work with them on analyzing that and developing outcomes measures. But one of our greatest resources is our existing partnerships with the state of Washington, and we are working to tap into them to statewide data sources that they own so that we can start opening up those data streams. And we're interested to see what other metrics or data points other sites use or have used and their successes in using that information to achieve goals or build partnerships, and how other sites have accessed Medicare data and Medicaid data. Do you guys have like other partnerships where other entities pull the data, or do you have your own internal IT staff that have the skill set to extract data from like SQL databases, for example? What are the methods you guys or the pathways that you're using to get that data?
Oh, you want to go back? There we go. Okay. So Oregon Wellness Network, we are a division of Oregon Association of Area Agencies on Aging and Disability, O4AD. So OWN serves as a network hub to provide support to all 16 AAAs across the state of Oregon in delivery of health, evidence-based health promotion services, care coordination, and behavioral health services. And what we're looking to do is sustain these programs. So we're looking for something that is financially sustainable. So looking to build wherever we can and so forth. So we have our team members, and all of them are actually, I think, on the call. And I didn't see if Jessica was there, but the top 5 are already there. And the top 3 represent, besides myself as operations manager of OWN, I also am wearing the hat of one of the AAAs, Northwest Senior Disability Services. Kate Scott is also from a AAA, Lane County, and Lauren Champagne is also from a AAA down in Rogue Valley. We have Jennifer Mead, who is from our state unit on aging, and also Katrina Sipe, who is with Health Insight of Oregon. And Jessica Walker is actually, this sort of highlights what we were talking about earlier, where Nikki from Western New York was talking about the fact that we've sort of formed a mini consortium, and it includes the Community Council of Dallas County, and that's Jessica Walker. So she's part of our learning collaborative. Going on. So our overall goal is to ensure that sustainable evidence-based health promotion programs are available across the state. So we have a lot of rural and frontier areas, and they're pretty small, so it's hard to have the infrastructure for this. So as a network hub, we try to support that those services so they can go out to all of the different areas. So our problem is that we need an IT system that will help us to collect and compile the data for the care plans and for patient information, so we can submit claims, so we can get some outcome reports, and also so that we can reconcile any denied claims. So it's all that revenue management side that we need help with. So some of our barriers, we're lots of diverse organizations. There's 16 AAAs, and so everybody has, you know, their own agendas and so forth, and they're all at different stages of readiness. We are largely social service type organizations, and so we've already had that challenge of trying to, you know, talk to the medical care system and let them know that we're legitimate providers of services, and that social determinants of health actually do contribute to health, and that we have little or no startup money. So we have to develop an IT system and work with whoever that vendor is to see if we can do this, some sort of revenue sharing. Okay. Our project goals are, again, select that IT system that meets our needs, and making sure that we have a billing infrastructure with streamlined data collection processes. Everybody's mentioned the hodgepodge, the several data bases that you have to submit to, and I can tell you, one program alone, we have to submit to the same data to 5 different databases, just to be able to get claims processed, to be able to keep our recognition, you know, and to satisfy some of our state agencies, et cetera. So it's pretty frustrating. And then we want to make sure that the system generates the outcomes that we want. So this looks like we have all these partners in place already, but really what this reflects is that, yes, we might have a program here and a site here that does these different things, but they are certainly not across the entire state. It looks really good, but we really need to and want to be able to share data and work collaboratively with all of these different agencies across the state. So here's our envisioning success. So what we're really looking for here is that we really want to make sure that we have a system that a single data entry point, that all of the OWN partners are able to easily enter the program data and be able to submit the needed billing information, and that we can receive payment on a timely basis. We also want to be able to do quality assurance without that being too cumbersome, and then making sure and give feedback to our partners to make sure that everybody understands what they need to do. So the next one, so it's a one-stop shop is what we're looking for, all-in-one solution for all program partners. I know it might be impossible, but as close to that is what we're looking to do. And in terms of learning and sharing, we're not sure there is an all-in-one solution, but we would like something that gives us as close to that as possible. And then I think we've learned that it requires a lot of FTE just to get this going, and so we're having to work through that. What we've learned so far is, or what are two things you hope to learn from other sites? Of course, we hope to learn a lot of different things, but we really would like to know what are the key elements that we should be looking for when we are trying to choose a system. And are there examples out there that have worked, and are they viable? Are they still viable? So those are the kind of things. And then I did want to share that, again, as Nikki mentioned from Western New York, we the Mini Collaborative has really helped us to get where we are so far, and we hope to continue to grow that. So that's.
I want to, with the 15 minutes that we have left, I want to do some reflection time. Lori's going to give us some reflections from her perspective, but I want to leave these questions up there on the screen for all of you to continue thinking about for the purposes of continuing to gather data for us as we design the activities of the learning collaboration. But Lori, please go ahead and give us your reflections as the members on this call go ahead and answer some of these questions directly.
Sure. We've had a lot of sharing back and forth and people responding to each other's questions. A special shout out, I think, to some of the top chatters. Lavina, two Megans, Whitney, Rebecca, Paul, and Jennifer have been really active. So thank you for doing that. A lot of the themes that we've heard have been lots of data all over the place, hodgepodge of data and multiple platforms. People want to be able to get paid for their services, want to be able to show the ROI and the outcomes, and really those are driving. That's what's driving the questions that they're asking, the level of IT expertise they have in-house, or how they're seeking IT expertise outside is another thing that people are asking about. Really also heard a little bit more about social determinants of health data and how that's being captured. So there were some questions related to that. Whether or not people are, collaborating on social determinants of health data, what that looks like, what kind of system you're collecting that with, how you're evaluating the HIT systems and which one's best. What kinds of funding are you using to support the data explorations? And PIMA was lucky enough, it sounds like, to have a donation to get this work started. Some questions about dashboards or tools for partners to easily access data, and how folks are thinking about whether they're thinking about a new system that just has the interoperability to work with other systems, or whether or not they think they can get access to other folks' systems, hospitals or healthcare systems. And some folks were saying that they think it would be better just to have a platform that was that had the interoperability to do that. And then there was a comment about the RTZ system, that thinking that at least 3 states on the call, Oregon, Washington, and maybe Arizona, use the RTZ system to track some of the core AAA services. and how looking at that system, if there's any way that that can better support some of the core data tracking and sharing needs. So those are some of the themes that I saw in the chat log and heard. So I think that folks are really answering each other's questions and talking to each other, which is what we're looking for.
Thanks, Lori. I appreciate the opportunity to think about this. I want, before I go to Antonia next, to talk about the collaboration and its connection to the larger networking, I want to please ask you, when we close down the webinar and evaluation come up, this is not your normal evaluation. We've got a really important question that we want everybody to answer about organizations that you think you might be well suited to connect with over the course of this. Obviously, everybody's going to connect to everybody in the cohort, but we are planning on making a couple smaller groups so we can have more intimate conversations. And so we have some ideas about how to organize those two subgroups, but we'd really be interested in your take on who you think would be really useful to connect to. So that will happen immediately when we close down the webinar, so please don't drop off before you've answered those questions. So let me go now to Antonia, who will talk for a couple of minutes.
Hi, everyone. I'm just going to go over really quickly about the all-in data for community health platform. So just to reiterate some of the information you've received in some handouts, this is an online platform that's a network of networks, and you have been invited to join it. So the main components of All-In are data and information sharing, multi-sector partnerships, and collaborative effort. So these are all going towards an outcome of improved capacity to drive community health improvement. The benefits of you participating is that you can continue this conversation online. We blazed through these presentations really fast, but the slides will be posted up there and you can review them and start chatting and connecting with everybody on the other teams on this platform. You can also share your resources that you found beneficial to the platform and post directly. And you can also search on the platform for other projects outside of the collaborative that might have helpful resources. So the best way to do it is to join. So if you join, make sure you try and complete your profile as much as possible and include a photo, which really helps to connect with others. I think some people have had some technical issues getting onto the private space on the system for N4A. So you may have received invitations from me, but I think you actually have to go into the system and request membership one by one. Sorry about that miscommunication. But once you're accepted, you're in, and you can see all the resources that we've posted up there. And then you also have the opportunity to go to office hours that'll give you a session that has more in-depth tour for you of the whole system. This is just a quick screenshot of what the N4A private page looks like. And I just wanted to point out the main points. The forum is where you can start threads for conversation and get more resources, and people can talk back and forth. And then in the resource library is where I've been posting any background information we have, any homework assignments, agendas, slides, anything that we circulate in the collaborative. But please note that those materials are for your use only and are not posted to the general all-in community. And that's just another picture of the resources. So this is what I had so far as of yesterday afternoon. I did a quick tally and run through to see who had joined. So welcome, thanks for joining. Sorry if others have had trouble joining, but we'll get it worked out. If you have any issues, feel free to give Antonia a call.
Thanks, Antonia. Before we go to Anna, I'll just say you all are amazing. We've been able to get through this very tight and packed agenda. I hope that the brevity of some of the presentations have only whetted your appetite. But let's go now to Anna Barnes to talk about next steps in collaboration.
Great, next slide. So we wanted to take the opportunity today to hear from everyone again, and we'll be working to finalize the breakdown of the 2 work groups and letting your team know which work group you've been assigned to. That will be coming out from us on Monday, so pay attention to your email on Monday. We'll also be sharing calendar invites then for those work group meetings moving forward, so they'll be set for the full year. So that's the breakdown, and you will certainly can still have opportunities to connect with the full cohort. Next slide. So we have a homework assignment before we convene again. Go ahead and sign up for the platform if you haven't already. Feel free to continue the discussions that we started today in that space. We are also going to email you on Monday a template for creating a high-level work plan, you know, outlining month by month your key activities that you're working on, so that we will have you submit those to us and then share them with your the peers in your work group to get suggestions, reactions, feedback around the timeline and how much time you've allocated to certain activities, or if a certain step should maybe come before a different step, just to sort of get organized around the work everyone is trying to do. And then the other piece is that we will be creating project profiles, 1-page project profiles, and we'll be sending those to each of you to review and sign off on, and those will be then posted in the platform as another kind of reference or cheat sheet to each site, so you know who's who and what's what. Next slide. If you have any questions about rescheduling or additional staff or partners that you'd like to add, you can email Antonia. And again, the next time we'll be talking with you will be on your the 2 subgroup work group meetings. And then this full cohort will convene again in January. So next slide. Thanks again, everyone, for carving out 90 minutes out of your day and bringing your team. The evaluation will be popping up at the end here as we close out the webinar. So thanks again and have a good afternoon.
Thanks, everybody. Congratulations on being a part of this, and we thank you for what is going to be a stimulating year. Looking forward to the next time we're together.